Hey, it's Dr. Troy here. I'm so happy you tuned in. Today's topic is degenerative disc disease. I can't say how many times patients come in and say, oh, my doctor said I have degenerative disc disease. There's nothing I can do except take these medications or maybe back surgery. And so what degenerative disc disease is there's joints in the spine. There's the bones. There's the discs. So when it gets labeled as degenerative joint or disc disease, that means these discs are degenerating. I like to say they're dehydrating. They're a water-filled, spongy type substance that is actually affected by gravity and trauma. And so over time, when my good friend says it's the load equation of gravity that pushes down the joint, extrudes the water out of the joint. So now the nerve roots that come off the spine in between the vertebrae become narrowed. So now you can get compression, you can get tension on those nerve roots, even the spinal cord, which can adversely affect the way your body functions and feels. You can get arm numbness, you could get leg numbness, you could get weakness in your arm or your leg, sciatic pain, back pain. You could even in extreme cases, you could have bowel and bladder trouble. Those are kind of cautionary, but in some cases we've seen people who have been helped with those. Even people who have loss of reflex in their legs or their arms. They have paresthesia, meaning one side of their body feels different than the other. Numbness, tingling, they can't walk on their toes or their heels. So these are all potential signs from degenerative disc disease. And so how does decompression of the spine help that? Well, number one, if gravity's pushing down on your spine and the discs are full of water, they're going to dehydrate. Just like if you push down a sponge, you're going to squeeze the water out. So how can you reverse that? Well, that's what spinal decompression is designed to do. We can focus specifically on the vertebral level and the segment by the way we position the pull or the angle of the traction that we use to pull the discs apart. So we can isolate certain discs to pull them apart gently, so we decrease the pressure in there. So now the water actually will suck back in to the joint. And over time, accompanied with some rehab protocols that we've developed and utilized over the last 20 years, we've seen many patients get better who have spinal degenerative disc disease who've been told, nothing can help you. Well, if you haven't tried spinal decompression, then you haven't been able to know if nothing can help you. So if you've tried other therapies, whether it's traditional medical care, or even alternative care, acupuncture, regular chiropractic adjustments, physical therapy, massage, and you're not getting the relief you're looking for, spinal decompression might be right up your alley to get you the relief. So if you're interested, call our office, 360-260-6903. If you have images, MRIs would be great to look at. We can review those with you and see if you qualify for spinal decompression or spinal decompression with traction. So this is Dr. Troy at Synaptic Chiropractic.